In continuation with my Read Aloud series from the Indian Economic Development textbook for class 11, I'm doing Unit 3, and in Unit 3 I'm doing chapter number 8, Infrastructure, and in that I'm doing Health. And in this I'm doing Indicators of Health and Health Infrastructure, a critical appraisal. As pointed out earlier, the health status of a country can be assessed through indicators such as infant mortality rate, maternal mortality rate, life expectancy, and nutritional levels, along with incidence of communicable and non-communicable diseases. Some of the health indicators and India's position are given in Table 8.4, which we'll discuss later. Scholars argue that there is a greater scope for the role of the government in the health sector. For instance, the table shows expenditure on health sector as 4.2% of total GDP, gross domestic product. This is very low as compared to other countries, both developed and developing. One study points out that India has about 17% of the world's population, but it bears a frightening 20% of the global burden of disease, GBD. So GBD, that is global burden of disease, is an indicator used by experts to gauge the number of people dying prematurely due to a particular disease, as well as the number of years spent by them in a state of disability owing to the disease. In India, more than half of GBD, that is global burden of disease, is accounted for by communicable diseases such as diarrhea, malaria, and tuberculosis, that is TB. Every year, around 5 lakh children die of waterborne diseases. The danger of AIDS is also looming large. Malnutrition and inadequate supply of vaccines lead to the death of 2.2 million children every year. At present, less than 20% of the population utilizes public health facilities. One study has pointed out that only 38% of the PHCs, public health centers, have the required number of doctors, and it is 30% of the PHCs have sufficient stock of medicines. Presently, if I can talk about the Mohalla clinics, they are doing a good job, especially in Delhi. So here now we come to urban-rural and poor-rich divide. Although 70% of India's population lives in rural areas, only 1/5 of its total hospitals are located in the rural areas. Rural India has only about half the number of dispensaries out of about 7 lakh beds. Roughly 11% are available in rural areas. Thus, people living in rural areas do not have sufficient medical infrastructure. This has led to differences in the health status of people. As far as hospitals are concerned, there are only 0.36 hospitals for every 1 lakh people in rural areas, while urban areas have 3.6 hospitals for 1 lakh people. The PHCs located in rural areas do not offer even X-ray or blood testing facilities, which for a city dweller constitutes basic health care. States like Bihar, MP, Rajasthan, UP are relatively lagging behind in healthcare facilities. In the rural areas, the percentage of people who have no access to proper care has risen from 15 in 1986 to 24 in 2003. Villagers have no access to any specialized medical care like pediatrics, gynecology, anesthesia, and obstetrics. Even though 315 recognized medical colleges produce 30,000 medical graduates every year, the shortage of doctors in rural areas persists. While 1/5 of these doctor graduates leave the country for better monetary prospects, many others for private hospitals, which are mostly located in urban areas. The poorest 20% of Indians living in both urban and rural areas spend 12% of their income on healthcare, while the rich spend only about 2%. What happens when the people fall sick? Many have to sell their lands or even pledge their children to afford treatment. Since government-run hospitals do not provide sufficient facilities, the poor are driven to private hospitals, which makes them indebted forever, or else they opt to die. Now we're talking about women's health. Women constitute about half of the total population in India. They suffer many disadvantages as compared to men in the areas of education, participation in economic activities, and healthcare. The deterioration in the child sex ratio in the country from 927 in 2001 to 914 revealed by the census of 2011 points to the growing incidence of female feticide in the country. Close to 3 lakh girls under the age of 15 are not only married, but they have already born children at least once. So, married women between the age of 15 and 49 have anemia and nutritional anemia because of iron deficiency, which so more than 50% of married women between the age group of 15 and 49 have anemia and nutritional anemia caused by iron deficiency, which has contributed to 19% of maternal deaths. Abortions are also a major cause of maternal morbidity and mortality in India. Health is a vital public good and a basic human right. All citizens can get better health facilities if public health services are decentralized. Success in the long-term battle against diseases depends on education and efficient health infrastructure. It is therefore critical to create awareness on health and hygiene and provide efficient systems. The role of telecom and IT sectors cannot be neglected in the process. The effectiveness of healthcare programs also rests on primary healthcare. The ultimate goal should be to help people move towards a better quality of life. There is a sharp divide between the urban and rural healthcare in India. If we continue to ignore this deepening divide, we run the risk of destabilizing the socio-economic fabric of our country. In order to provide basic healthcare to all, accessibility and affordability need to be integrated in our basic health infrastructure. Now, to conclude, infrastructure, both economic and social, is essential for the development of a country. As a support system, it directly influences all economic activities by increasing the productivity of the factors of production and improving the quality of life. In the last 6 decades of independence, India has made considerable progress in building infrastructure. Nevertheless, its distribution is uneven. Many parts of rural India are yet to get good roads, telecommunication facilities, electricity, schools, and hospitals. As India moves towards modernization, the increase in demand for quality infrastructure, keeping in view their environmental impact, will have to be addressed. The reform policies, by providing various concessions and incentives, aim at attracting the private sector in general and foreign investors in particular. While assessing the two infrastructure, energy and health, it is clear that there is scope for equal access to infrastructure for all.